Hi, I'm Sherry Erickson. I'm Vice President of Governmental Affairs and Medical Practice at ACP. I've been here for 11 years now, working on regulatory affairs area, health policy, and practice support areas within the college.
Hi, I'm Bob Doherty, Senior Vice President of Governmental Affairs and Public Policy for ACP. I've been advocating for internists for over 40 years and have overall responsibilities for our Washington, D.C. Advocacy Department, policy development, and all the related activities.
Great. So one of the things we wanted to talk about was access to care and some of the things that ACP is doing to improve access to care for the patients of our members.
Yeah, it's a good news and bad news situation. The Affordable Care Act, which turned 9 in March, has done a lot of good in terms of expanding coverage for tens of millions of people, protecting people with pre-existing conditions, eliminating annual and lifetime caps and benefits, and so forth. But we're very, very concerned by a decision by a Texas judge that, if upheld on appeal, would gut the entire ACA, and the decision by the administration not to defend any part of the ACA. Right. So if that were upheld, that decision at a circuit court level, everything in the ACA goes away. No funding for Medicaid expansion. If you have pre-existing conditions, you can be charged more again, or even turned down. No cover for essential benefits. The Medicare Part D donut hole, which is being phased out under the ACA, that would go away. So it would be absolutely devastating. And it's not like there's a replacement in place should that occur. It would just blow everything up and create chaos in the system. So we've been very involved in this. We submitted a friend of the court brief at the time of the initial decision that we hoped was going to be persuasive to that Texas judge. Right. Unfortunately, I don't think he gave enough consideration to our concerns. And we are joining in front of the court brief at the circuit court level. Okay. We don't know exactly when there will be a decision. There are going to be oral arguments, I believe, on July 1. And most people think that no matter how a circuit court rules, is going to go to the Supreme Court, right. Which means if the Supreme Court takes it, it could come out with a decision right before the elections, right. 2020 elections. So that's a significant concern. At the same time, we are hoping that there would be bipartisan support for things to stabilize the current insurance markets. We have some ideas on how that could be done, and there is legislation that's been introduced on the House side to do that we are supporting. And on the Republican side, Senator Alexander, chair of the Health Committee, he has indicated interest in doing bipartisan bills to shore up the markets under the existing law. Right. Having said that, there are other threats to access, and I wanted to ask you about one that I know you're very familiar with, which is funding for Title X clinics.
Right, right. So there's been a final rule released by the administration that significantly impacts access to care for women in particular, and particularly women in low-income and underserved areas who may be seen by clinics that receive Title X funding. And so we're very concerned about that, in that it not only impacts the funding for those programs and for those clinics in particular that may need to shut down, but the clinics that are nearby, the federally qualified health centers, et cetera, that are nearby really don't have the capacity, and have indicated themselves that they don't have the capacity to take in the patients that will be losing services through Title X. And for those that aren't familiar with Title X, it is funding for clinics that offer reproductive health care services to women and families. So it's a significant program that allows women in particular to have access to these services.
That's really concerning. And speaking about women's health, Congress is also considering the Violence Against Women's Reauthorization Act. Right. This is legislation that has long had bipartisan support, and it funds programs to assist women who are victims of domestic violence. And it's in the past not been controversial. But the NRA has been urging Congress to defeat the Violence Against Women's Act because the current version closes domestic violence loopholes. Right. Under current federal law, most people aren't aware that although if you have a misdemeanor conviction for domestic violence or a temporary restraining order, that's reportable under the background check system, and you're not allowed to buy guns. But there's a huge loophole. If you commit domestic violence against somebody outside your home, say you've stalked somebody, or you have a temporary restraining order, those are not reportable. You can still buy guns. Right.
And you're reminding me, though, when you're talking about that policy paper with regard particularly to Title X and women's health overall, we had actually 2 policy papers that were released last year, I think it was, that focused specifically on women's health and women in medicine. and also laid out a number of these concerns with regard to access to services, to reproductive health care services, also issues related to domestic violence, and ensuring that they have protections and, again, access to those services. So.
Yeah, I was really concerned. Medscape came out with this annual salary surveys,
Yes.
and they just showed, again, huge disparity in compensation to female physicians compared to male physicians.
Right.
So we have a long way to go, and that's something ACP called out in policy 2 years ago.
Right.
But clearly we have a long way to go.
Yeah.
That paper also showed that the administrative burden, that's escalating, it's not going down.
Right.
So on that, I did want to ask you a little bit about our Patients Before Paperwork initiative to address administrative tasks.
So that's been an initiative we've had in place since 2015, and really focused on reducing administrative burden for our members, but also looking at the impact on physicians as well as on the patients and the system as a whole. And I think it was a couple of years ago now that we released a policy paper that outlined a number of recommendations along these lines. And since that policy paper came out, we've done a significant amount of follow-up and continue to take action, addressing it with the administration, as well as with Congress in a number of different ways. Most recently, we provided significant amount of comment to the Office of the National Coordinator on a draft strategy that they put out on reducing physician burden, administrative burden, and also we're providing comments to the Office of the National Coordinator and CMS on a couple of other recent proposed rules that they have put out to improve interoperability and reduce information blocking. That we want to ensure that while those are some positive changes, that they don't increase administrative burden to levels that are just not appropriate.
And also, when we looked at other countries' healthcare systems, one thing you see is most of them invest far more in primary care than we do in this country, and that's got to be part, I think, the solution to make our healthcare system more accessible, higher quality, and lower cost.
Great. Yeah.
Well, I've enjoyed the conversation with you, Shari, and we'll keep working together to bring about these changes.
That's right. Sounds good.